Hello, everyone. This is Dr. Hashem Hasabala, coming to you live from the ICU. So if I have to pause to take a phone call from the unit, please forgive me, ask your indulgence. But this is on this episode of Healthcare Musings podcast, we're going to talk about denials. We're going to begin to talk multiple episodes about the phenomenon of insurance company denials, their frustrations, what they are, and how to mitigate against their impact. So they can be terribly frustrating. I mean, it, it's. I mean, I have suspicions as to why private insurance companies do this, but given my work as a physician advisor with Sound Advisory Services that I've been doing for almost a decade now, I've been in the insurance denial space for many years, and so they're very frustrating. Unfortunately, they seem to be a part of life, and so we need to know what they are, what kinds of denials come through, and how to mitigate as best we can. So the first type of denial that we're going to talk about is the prior authorization denial. So there was a lot of news recently about United Healthcare and their implementing prior authorization requirements for colonoscopies, which is a established screening tool for colon cancer. And there's a lot of outcry and pushback from clinicians, rightly so. And then they kind of walked back their decision, and I'm very happy about that. But what a prior authorization denial is that before a procedure or surgery or even an imaging study is done, you need to go to the insurance company and get a prior authorization. Okay, if the insurance company requires this prior authorization and it's not done, they will deny payment. And then a lot of times, or the hospital system, or the surgery center, or the imaging center will then ask for payment for the patient. Okay, and it's another hurdle, right? It's very annoying. Like I can't, if my doctor wants me to get a nerve conduction study or a CT scan or an MRI, I should just be able to go get it, right? And no, I have to get permission from the insurance company. So, it's very annoying. It's an extra hurdle, right? It's a delay in care. Now, nobody's going to call the insurance company and say, I'm having chest pain, I need to go to the ER, I need to get prior authorization. And if an insurance company denies payment because someone did not get authorization for an emergency room visit, which I don't think happens, and if it did happen, it would be egregious. That would be outrageous. And so, when you get a denial, what you need to do then is retrospectively go and um, write an appeal arguing for the medical necessity of the procedure after the fact. So it's done, the imaging study's done, the procedure's done, they've denied payment. Now you got to go back to the insurance company and say, well, here's what the doctor said, here's what the patient presented with, here's what the doctor wanted, and therefore you need to approve it post procedure, right? And hopefully, hopefully that'll be enough. Sometimes it is, sometimes it isn't. Now, recently efforts have been made to lighten the burden of the prior authorization process. I know there's been a lot of press about the burden of prior authorizations. The AMA has talked about it. There's the Office of the Inspector General for Medicare Advantage, for CMS. They've also looked into it. So, but just as unfortunately, this is a fact of life, and it's something that I think we need to be cognizant of. We need to understand, and this even adds an administrative burden and the cost of healthcare, frankly, for an office practice to have to employ someone that makes sure for the various different payers which one requires prior authorization and which one does not. I mean, that adds cost of healthcare. I wish it wasn't so, but unfortunately, it is so. And so those are that's the first type of uh, denial that private insurance companies will do, and we just have to be diligent so that we don't have to deal with these denials. Thank you very much for listening and your attention, and we'll see you next time.